Namaste Bitya, Hamisha Khushro. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, JAIPUR. In today's lecture, we are going to continue with bronchial asthma. In the last lecture, we had discussed about the definition of bronchial asthma and the various factors and also the pathogenesis. In today's lecture, we are going to continue from that particular lecture. We have studied that asthma, it is a syndrome that is characterized by airflow obstruction, and it varies markedly, both spontaneously with their treatment. Asthma shows a chronic airway inflammation and is increased airway hyperresponsiveness. The typical symptoms of bronchial asthma includes wheezes, cough, chest tightness, and dyspnea. So the chief complaints, it is characterized by airflow obstruction, and it varies markedly and both spontaneously with the treatment. In asthma, there is chronic airway inflammation and increased airway hyperresponsiveness. The typical symptoms of asthma includes wheezing, coughing, chest tightness, and dyspnea. So we have wheezes, we have coughing, we have chest tightness, and we have dyspnea. It is accompanied by the presence of airflow obstruction. And this airflow obstruction is variable over the short period of time. Now, what are the clinical features of bronchial asthma? Whenever a patient of bronchial asthma is coming to us, what are the clinical features with which the patient can present to us? The clinical features includes wheezing, there is dyspnea, there is coughing. So these are the most important features. We have wheezing, we have cough, and we have dyspnea. These features are variable both spontaneously and with the therapy. The symptoms can be worse at night, and the patients typically awake in early morning hours. There is increased mucus production with a tenacious mucus that is difficult to expectorate. So we have wheezing, we have dyspnea, we have coughing, wheezing, dyspnea, coughing, that is variable with time. The symptoms are worse at night, and the patient typically awake in the morning hours. There is increased mucus production and the tenacious mucus that is difficult to expectorate. The prodromal symptoms includes, or the prodromal symptoms that precedes the attack are itching under the skin. We have the patient complaints of itching under the skin before the attack of asthma. There is also discomfort between the scapula. There is inexplicable fear because of the constriction. The physical signs includes inspiratory and expiratory bronchi throughout the chest and with hyperinflation. There is also non-productive cough. So clinical features includes wheezing, dyspnea, coughing, and it is variable spontaneously and with the therapy. The symptoms are worse at night, and the patient is typically awake in the early morning. There is increased mucus production with tenacious mucus that is difficult to expectorate. The prodromal symptoms that precedes the attack are itching under the skin. There is discomfort between the scapulae and inexplicable fear. The physical signs includes inspiratory and expiratory bronchi throughout the chest and with hyperinflation. There is non-productive cough. The asthma is mistaken for cold or chest infection that is failing to resolve. There are precipitants that include exercise, cold weather exposure to airborne allergens or pollutants, and viral upper respiratory tract infections. The patient with mild intermittent asthma are usually asymptomatic between the exacerbations. The patients with persistent asthma, they report ongoing breathless and wheezing. In some circumstances, the asthma is triggered by medications. Example, aspirin, non-steroidal anti-inflammatory drugs. These induces bronchospasm and may also induce wheezing. This presents in the middle age with asthma, rhinosinusitis, and nasal polypus. In the severe acute asthma, there is increased chest tightness with the wheezing and dyspnea that are often not relieved by usual reliever inhaler. So in the severe acute asthma, there is severe chest tightness. There is also wheezing and dyspnea that is not relieved by usual reliever inhaler. The patient also complains of breathlessness that is unable to complete sentence, and the patient may become cyanotic. So in the case of severe acute asthma, there is increasing chest tightness, there is wheezing and dyspnea that is often not relieved by the reliever inhaler that was usually relieving the complaints. The patient becomes cyanotic and he is breathless and unable to complete the sentences. The signs: increased ventilation with hyperinflation and the tachycardia. There is marked fall in the spirometric volumes and PEF, peak expiratory flow volume. The arterial blood gas show hypoxemia and the PCO2 is usually low due to hyperventilation. So the arterial blood gas on the air shows hypoxemia and PCO2 that is usually low and is due to the hyperinflation. The diagnosis is usually apparent from the symptoms of variable and intermittent airway obstruction. The lung function test consists of simple spirometry. There are various other tests which includes certain hematological tests, which includes total serum IgE and specific IgE to the inhaled allergens. Radioallergosorbent test RAST may be measured. The skin test includes skin prick test to common inhalant allergens, measurement of allergic status by skin prick test, total and allergen specific IgE. There is also radiological examination, which includes the chest X-ray appearance, hyperinflation of the lung fields, assessment of eosinophilic airway inflammation by the exhaled nitric oxide levels. So the diagnosis of bronchial asthma is usually apparent from the symptoms of variable and intermittent airway obstruction. There are various lung function tests, which include simple spirometry, hematological test, which includes total serum IgE and specific IgE to the inhaled allergens. It includes radioallergosorbent test that may be measured. In the skin test, there is skin prick test to the common inhalant allergens with the measurement of allergic status by skin prick test, total and allergen specific IgEs, various radiological examination, which includes the chest X-ray appearances with hyperinflation of the lung fields, assessment of the eosinophilic airway inflammation by exhaled nitric oxide levels. The differential diagnosis includes the upper airway obstruction by a tumor or laryngeal edema. Left ventricular failure may mimic the wheeze of the asthma. And there are basilar crackles that are present in left ventricular failure. COPD. So these are the various differential diagnoses. The differential diagnosis includes upper airway obstruction by a tumor or laryngeal edema. Left ventricular failure may mimic the wheezing of asthma, in which basilar crackles are present in left ventricular failure. And there is chronic obstructive pulmonary disease, that is COPD. Next, we come to the management part. In the management part, we have two types of management. One is general management and the second one is the pharmacological management. General management consists of a specific inciting agents for asthma. Asthmatic symptoms can be identified and eliminated. So there are various agents, specific inciting agents for asthmatic symptoms. These can be identified and can be eliminated. We can set the goals. It is a chronic condition, but effective treatment is available for majority of the patients. The treatment protocol includes the partnership between the doctors, nurses, and the patients. Patient education is very important, and avoidance of the aggravating factors. There are different types of pharmacological therapies. So, what are the pharmacological therapies? In most of the cases, the pharmacological therapy is required, means giving medication to the patient. The pharmacological therapy includes the bronchodilators with beta-2 adrenergic agonist. There are various types of beta blockers, anticholinergic drugs. So we have bronchodilators with beta adrenergic antagonist, beta blockers, and anticholinergic drugs. There are also different types of controller therapies, which includes inhaled corticosteroids and systemic corticosteroids, which is intravenous hydrocortisone or methylprednisolone. A stepwise approach to asthma therapy according to the severity of asthma and ability to control the symptoms. It includes inhaled corticosteroids, LABA, that is long-acting beta-2 agonist, and OCS, that is oral corticosteroids. In the management of severe asthma, there is an optimal face mask to achieve the oxygen saturation of greater than 90%. High doses of SABA is given either by nebulizer. SABA is short-acting beta-2 agonist. Sedatives should never be given because these may depress the ventilation. Next, we come to the homeopathic management. There are various homeopathic medicines which can be given in case of bronchial asthma. Some of the important homeopathic medicines includes Ambragresia, ammonium carb, argentum nitricum, arsenic album, ars iodum, bromium, cuprum met, ipecac aquana, calicarb, lobelia inflata, Nephitis, pulsatilla. We have Sambucus nigra, Salacia, Spongia, Stramonium, and sulfur. I will discuss the indication of few of them. Ambragresia, with the asthmatic breathing with eructation of the gas. There is nervous spasmodic cough with hoarseness and eructations. Ammonium carbonicum, cough every morning at about 3 o'clock with dyspnea, palpitation, burning in the chest, and worse ascending. Argentum nitricum, the high notes produces cough with chronic hoarseness, suffocative cough with dyspnea, painful spots in the chest. Arsenic album, when the patient is not able to lie down and fears suffocation. The air passages are constricted and asthma is worse in night. There's burning in the chest with suffocative fatigue. Cough is worse after midnight, worse lying on the back. There is expectoration scanty, frothy, and darting pain through the upper third of the right lung. There is also wheezing respiration. Arsenic iodated, when there is slight hacking cough with dry and stopped up nostrils. The cough is dry with little difficult expectoration. Bromium, when the dry cough is there with hoarseness and burning pain behind the sternum. There is spasmodic cough with rattling of mucus in the larynx, suffocative hoarseness, and difficult and painful breathing. There is violent cramping chest pain that runs upwards. Every inspiration provokes the cough. There are spasmodic constrictions with asthma, difficulty in getting air into the lungs. Next is chlorellum hydratum with sudden dyspnea from spasm of the vocal cords, with starting protruding eyes, blue face, cold sweat, pulse is small, with inspiration free and obstructed expiration. Cuprum metallicum, when the cough has a gurgling sound and is better by drinking cold water. Suffocative attacks are worse at 3 a.m. with spasm and constriction of the chest. There is spasmodic asthma alternating with spasmodic vomiting. Ipecacuanha, when the dyspnea is constant with constriction of the chest. Calicarbonicum, when there is dry hard cough about 3 a.m. in the morning with stitching pains, expectoration scanty and tenacious, but with increasing in the morning and after eating. Next, we have lobelia inflata, when the dyspnea from constriction of the chest. Nephritis, with the suffocative feeling in the asthma paroxysm and spasmodic cough. Next, we have Blata orientalis. It is a remedy for asthma, especially associated with bronchitis. Aridactylon californicum, that is Yerba Santa, when there is wheezing, asthma, and coryza and mucous secretions with a dull pain in the right lung, burning in the fauces, and asthma better by expectoration. Next, we have Spongia tosta, with asthmatic coughing worse in the cold air. So this was all about the management of the bronchial asthma. In this way, the bronchial asthma is complete. In the next lecture, we will be starting with a new topic. So this session is powered by Digital Version 2.0 JAYOTI VIDYAPEETH Women's University. I hope this session is clear to you. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. Have a good day.